What is a minimally important difference, or MID, and why do we need it? When we measure temperature, weight, or anything on a scale, what is an important change? How do we know it's important? In patient-reported outcome measurements, a minimally important difference is the smallest difference or change in an outcome that a patient feels is important. The core of a minimally important difference is that it can be noticed by patients and it is valuable to patients. We can use a more everyday example to explain this. Imagine a group of overweight people who are trying to lose weight. The smallest decrease in weight that each person feels is important to them matters. It is normal for weight to change throughout the day. Does this weight loss matter? No, people don't care about it that much and know it will change back or change again. Also, if you use a different scale, your weight might be different. Does this change matter? No, that's just an error. Does a statistically significant weight loss, which could only be 3 to 5 pounds, really matter for overweight people? That depends. A statistically significant weight loss of 3 pounds for overweight people with an average weight of 200 pounds may be hard to notice. An important change to overweight people might be the one that changes the way he feels, that his body image is different, his confidence has increased, or any weight-related symptoms have improved. However, the tricky part is getting the minimally part just right. A 50-pound weight loss for an overweight person is a big change. But what about 20 pounds, 10, or only 5 pounds? Of course, you would have to lose 5 before you could lose 10 or 20 pounds, and the starting point influences the MID. If you are trying to lose weight and measuring it, at what point is this a meaningful loss? This threshold is the minimally important difference. Now, substitute weight for any patient-reported outcome measure. After all, it's just another form of data. You may want to ask why we need to make all these efforts to get a minimally important difference. Imagine you are a physician and one of your patients is trying a new therapy. He reported an EQ-5D index score of 0.5 before treatment, and after 3 months, it's changed to 0.55. Does this matter? What does this change mean? What is the degree of improvement? A change of 0.05 is confusing to explain to the patient. But if you could tell your patient that a change of 0.04 in an EQ-5D index is a minimally important difference for similar patients with that therapy, then your patient has a better understanding of this change. Going back to the group of overweight people, a certain population could have a different MID, for example, men versus women. When you measure also matters. Are you measuring it once or comparing measurements over time? There are many different MIDs published for different populations. How do you choose the right one? In our research, we are exploring which ones are best and why. Is a certain minimally important difference the same for all applications? Watch our next video or visit our website to find out.